Hello.
Hi.
My name's Andrew. I'm a physician assistant
Nice to
student.
meet you.
How are you doing today?
Great.
Great. Can you just confirm your name and date of birth for me?
Sure. Lawton Atley, 8/23/83.
Okay, great. So how old are you then?
I'm 34.
34. Okay, great. Let's see. So tell me, Lon, what brings you into the office today?
It's not really just like one specific type of pain.
Okay.
I have pain sort of all over, and some days it's in my back, some days it's in my neck, other days it'll be in my shoulders. I mean, I just wake up every morning and I'm in pain.
Okay.
Like, it's kind of, some days it's better than others, and like I said, it's not always in the same place, but I'm just always feeling, yeah.
I'm sorry to hear that. So we're going to review that a little bit, but first I want to get to know a little bit about yourself.
Okay.
So can you tell me where you work?
Right now I'm a student.
Okay, what school do you go to?
I go to Jefferson University.
Okay, great. And what are you studying there?
I'm studying to be a physician assistant.
Oh, great. Good to know. So what would you say your general state of health is other than your pain?
I mean, I don't have to take any medication, and
Right.
I don't have any like health problems, but I just feel awful all the time. I mean, anytime I've gone to the doctor, they say everything's fine, but I don't know how it could be
But now
because I feel
you're
awful.
saying, okay.
Yeah.
Okay. Are you married?
No.
Not married, okay. Can you tell me a little bit about your significant past medical history, let's say within the last 6 months or so? Have you had anything that has come up other than what you're describing to me today?
No. No. I have nothing unusual. I mean, my life is pretty much the same. I'm a student, so I'm kind of on the same schedule every day.
Okay.
Yeah, nothing out of the ordinary. I haven't like been anywhere. I haven't been to the hospital for anything. I haven't really been sick or anything.
Okay. I'm just going to check your chart real quick and make sure that everything's up to date here. Okay. So let's talk a little bit about why you came in today.
Okay.
When did you first notice that you were having this pain, or was it like a sudden thing, or tell me a little bit about that?
I mean, it's been for years. It's been like the last maybe month that it's just so bad that I just don't feel like getting out of bed in the morning.
Right.
I would say it's been ongoing about 5 years.
5 years?
Yeah.
Okay. And did you notice anything leading up to when you started noticing the pain? Anything in particular that may have set it off?
Like today, or just like about a month ago when it started?
5 years ago, before everything started.
No, I mean, I was working and just doing my thing, and I didn't get hurt or anything like that.
Okay,
I
so
wasn't sick, no.
Okay, so in other words, this is more of a gradual onset. You wouldn't say that one particular thing has caused, in your mind, your symptoms.
No, I mean, if I'm tired or, under a lot of stress, it's worse, which maybe is now why it's worse now that I'm in school, but, no, I can't say like, oh, I did this and then tomorrow when I wake up, sometimes I'll be feeling great one day, the next day it hits me, then another day I'm, really suffering, and I wake up the next day and it's not as bad.
Okay, so it changes from day to day.
Yeah, I mean, lately it's been every day, but it's kind of, sometimes it comes and goes. It's not the same every day, let's put it that way.
Is there anything that makes it worse that you've noticed?
Everything seems to make it worse. I mean, I thought maybe if I exercise more, but that didn't help. Sometimes it seemed to make it worse, and I tried not drinking coffee or tried getting more sleep, go to bed earlier. I wake up, I still feel terrible. Nothing really seems to make it better.
Okay, so tell me, have you tried anything other than you said coffee and things of that nature? Anything in particular that you've noticed?
I mean, I can take Tylenol or Advil sometimes when I need it, but it doesn't go away. I mean,
Right, it's constantly there.
yeah.
Has this ever happened to you before?
Like
Before
4 or 5 years ago when it really kicked in. No, I don't remember feeling like this when I was a kid. It just seems like as I've gotten older, it's just gotten worse.
So from what I'm getting out of this, you have pain, you said, all over your body pretty much?
Yeah, I mean, lately it's been more in my back, but it could be anywhere.
Okay.
Yeah.
Can you describe what type of pain is it?
Yeah, it's just like, I guess, feels like someone's just grabbing my muscle and just squeezing it tight. Like it's in a vice grip, like just muscle pain.
Okay, so a squeezing pain.
Yeah.
And as far as each region, I know you said it's widespread. Do you notice that the pain radiates from one spot to another, or does it more so just stay in one spot?
It can radiate, if it's in my shoulder, sometimes it goes down my arm. If it's in my back, sometimes it'll go down my legs. It doesn't necessarily just stay in one place.
And can you describe for me on a scale of 1 to 10, with 10 being the worst pain you've ever had in your life, how is this pain? You can go region by region or just in general, just so I get a better understanding of it.
I mean, it depends on the day. I would say on my worst day, it's like an 8 or a 9 to where I just don't want to get out of bed. Some days, like today, I'm up moving around, maybe a 5, 6.
Okay. And do you find that when you do move around, it gets a little bit alleviating, or is that not associated with your pain?
It just depends on the day. Sometimes it seems better if I get up and move around, and then other days I get up and move around and I just want to sit back down again.
Right. Do you notice at a specific time of the day where it could be getting more painful, less painful?
Yeah, I usually feel worse in the morning. I wake up in the morning and I just feel like I was running a marathon all night instead of sleeping.
Okay, so I'm going to ask you some more questions
Sure.
that are a little bit more particular to your pain. So can you tell me, bear with me here, have you had any, I know you said it's a pain, is it more of a muscle or a joint pain, would you say?
It's kind of both. It usually hurts mostly around my joints, but it is kind of spread into my muscle.
Okay. Have you had any stiffness within your muscles, or is it more just of a pain?
No, I feel stiff, especially in the morning when I get up.
Okay. Have you tried stretching? Any exercises like that?
It doesn't help. I mean, I don't feel better after I exercise.
Okay, but you have tried it.
Yeah.
Okay, that's good to know. Have you had any arthritis in the past?
It was a few years ago when I said my back was really hurting. My doctor did some x-rays and he said it was like normal for someone my age. I mean, some mild wear and tear, but nothing serious.
Okay. Have you ever had gout?
I don't know what that is.
Okay, you ever had any problems with your nails?
No.
Or has anybody ever told you you've had gout? Okay, you said you had backaches. Is that associated with this, but have you had backaches in the past? Not associated with this pain that you're having now?
I don't think so. I mean, I can't really tell, honestly, but
Okay.
it's kind of all the time, It's hard for me to say if something's coming from one thing or coming from something else.
Have you noticed any swelling in the areas of your pain?
No, not really.
Okay. Have you noticed any redness?
Mm-mm.
How about tenderness?
To touch it, you mean?
Yes, to touch it.
Yeah, it hurts to touch it.
Okay. Is it warm to the touch?
Mm-mm.
No. Okay. Have you ever had any trauma in the areas before you mentioned that you didn't? Um, you
I
have-
mean, yeah, I was in a car accident when I was 14, and I know I got X-rays and stuff, and I mean they let me leave the hospital that day, so I guess if there would have been something really bad, it would have shown up.
okay. Well, that's good to know. Thank you
But
for
yeah,
sharing.
I mean I remember I had whiplash and like my back hurt and stuff, but
Okay. Have you had any of this? You said you had joint pain.
Mhm.
Have you ever noticed that you've had fever or chills associated with the joint pain?
No,
How about a rash?
oh no,
Have you ever had any joint pain paired with weight loss that you've noticed?
no.
How about weakness?
Mm. When it's like really flaring up, like when I'm really in pain, yeah, my muscles feel weak. Like I just feel like I can't lift anything or move things around the house.
So I'm going to move on to a portion of the exam
Okay.
regarding your psychiatric health.
Okay.
And I want to let you know that anything that you share with me is confidential,
All right.
and I'm not allowed to share it with anybody else. So it's just us in here, and I want you to feel safe talking to me about it.
All right. Sounds.
So, have you had any nervousness associated with your symptoms?
No.
Okay. Have you had any tension?
Tension.
Yes, you ever felt tense because of your pain or how you've been feeling?
No, not really.
Okay.
Not tense.
How could you describe your mood as from day to day? I know you said it's tough to get up in the morning.
Yeah, it's not good. I mean,
Okay.
especially on my bad days, it just, I don't know. I just feel like no matter what I do, I feel like crap, and I don't want to get out of bed, and I sleep all night or all day, and I still feel like crap when I wake up, and it's not good.
Okay, would you say that you have to, or do you feel like you are depressed a little bit?
Like, I know my life isn't bad, and like I appreciate, you know, the people in it and stuff, but when you wake up and feel like this every day, it's hard to be excited about anything. I mean,
Okay.
I don't think I'm depressed like in my mind, but it's like my body thinks otherwise.
Okay. Have you had any changes in your memory?
Yeah, like I have like it's hard. It's like I have a fog. Like some days it's just like you could tell me something 3 times and it doesn't stick.
Right.
I just can't. I don't know. It's like hazy, you know.
So what you're explaining to me right now is regarding your short-term memory. Have you had any changes in your long-term memory that you've noticed?
Not really. No. No. It's usually more like just I can't concentrate on things, you know, or
Right.
yeah.
Okay. So have you had any thoughts of suicide?
No.
Anything like that? Okay,
No.
that's good. Have you ever attempted suicide?
No.
Okay. Have you ever gone to counseling for any psychiatric issues?
No.
Okay. So I'm going to move on to a portion of the exam regarding your medications and allergies.
Okay.
So do you take any medications? These could be things like vitamins,
Sure.
over-the-counter pills.
I take Zyrtec for like seasonal allergies.
Okay.
So yeah, I've been
Anything
taking
else?
that. Anything else? Yeah, I mean sometimes I take a Tylenol or Advil when I have really bad days with the pain, but you know, it doesn't really help, so I don't take it that often.
How many do you usually take?
Um, like 4 over the whole day. You know, I might
Okay.
take 2 in the morning and then like 2 in the afternoon.
Okay.
I mean, I follow the directions on the bottle.
Right. And you do the same for the Zyrtec?
Oh, just 1 a day for the Zyrtec. It says just 1 a day.
Okay. Is there any other medications that you take, or just those 2?
No.
Okay. Do you have any allergies to things like medications,
Yeah,
insects, or
I
food?
have an allergy to Cipro.
Okay. And what happened?
I broke out in hives all over.
Okay. And when did that happen?
Probably 10 years ago. They told me I should always remember that.
Great. I'm glad you shared that with me. And specifically, have you had any latex allergies that you've noticed, or has anybody ever told you you've had a chlorhexidine allergy?
No.
How about an iodine allergy? So I'll move on to your past medical history now. Can you tell me about your childhood illnesses? Have you had any significant illnesses that I should know about?
I had the chicken pox when I was about 3.
Okay.
I think that's it. I was never in the hospital or anything. That's it.
Okay. So I'm going to ask you about your other illnesses that you've had. So these are just yes or no questions. Okay. Measles?
No.
Have you ever had mumps?
Nope.
You mentioned chickenpox.
Yeah.
Rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Or any psychiatric disorders? Okay, I'm going to review the immunizations to make sure that you're all up to date. So have you had an immunization for polio?
Yep.
How about MMR, which is measles, mumps, and rubella?
Okay, yep.
The flu shot or the spray?
I had it last year, I didn't have it this year yet.
Okay. So tetanus?
Yeah.
And how about diphtheria?
Yeah.
How about pertussis?
Yeah.
Hep B?
That's the one with the 3 shots?
Correct.
Yeah.
The chickenpox vaccine?
Yeah.
Got it, okay.
I actually did have the vaccine even though I had chickenpox.
Okay, that's good to know. And how about the pneumococcal vaccine?
No.
Haven't had that, okay. Okay, so the only 2, just to review, that you're missing are pneumococcal and the flu shot.
Yeah.
Okay, so we're going to move on to your adult illnesses.
Okay.
So have you been hospitalized in the past, let's say 6 months for anything?
No.
How about in your entire life, have you ever been admitted to the hospital?
No.
Okay, great. So more specifically, do you have any hypertension?
No.
That you know of? Diabetes?
No.
Tuberculosis?
No.
Heart disease?
No.
Lung disease?
No.
Kidney or thyroid disease?
No.
HIV?
No.
Any seizures?
No.
Any cancer?
I had a skin cancer removed from my abdomen, right here, next to my belly button.
Okay.
In 2015.
Okay, and did you notice any complications after that was removed?
No, they told me that it was early, so I didn't need any more treatment.
Great. Do you have asthma?
No.
Do you have hepatitis?
No, I don't think so.
Okay. We're going to move on to the accidents and injuries.
Okay.
So, you mentioned you were in a car accident. What year was that in again? You said you
When I was 14, so let's say 1997.
Okay. And what was your treatment for that? You mentioned you had an X-ray.
Yeah, I went to the emergency room and I had an X-ray, and I guess it was okay, and nothing, nothing happened.
Did you get prescribed any medication for that injury?
I think I had muscle relaxers for the whiplash.
Okay. And would you say that you are fully recovered since then?
Yeah, I mean, as far as I remember, I don't remember having any problems after that.
Okay.
It was a long time ago, though.
Have you had any other accidents or injuries, either similar to that or of that nature, where you had to go to the hospital for?
I broke my nose when I was 21.
Okay. And did you have any surgery or anything like that?
No.
Did you have any treatment?
You no.
Okay, so
I went to the doctor. He said I could breathe. He said if I wanted to get it fixed, it would be more for cosmetic. But
great. Have you had any other accidents or injuries I should know about? Okay, so you mentioned that you were not admitted to the hospital in your lifetime. Is that correct?
correct.
Have you ever had any surgeries?
Just the skin cancer.
Just the skin cancer. Okay. Do you remember what type of cancer it was?
Melanoma.
Melanoma. Okay. So I'm going to review the screenings
Mm-hmm.
and just in general your health maintenance now to make
Oh,
sure
okay.
that you're all up to date, and we can prevent anything further if you're not up to date.
Okay.
So you mentioned you did not have a flu shot this year, correct?
Mhm.
And do you know if you've had a zoster vaccine?
No.
No. Okay. Have you had a pneumonia shot?
No.
Okay. Have you ever gotten a colonoscopy? I know you're a little bit young for that,
No.
so okay, well, that's fine. Have you had a recent prostate or testicular exam?
No.
Have you ever had a DEXA scan?
No.
Okay. How about a tuberculosis test?
Yeah.
Had that. Okay. And that was just the skin test, correct?
Yes.
And how long was that?
3 months ago.
Okay. Have you ever had a cholesterol test?
Yes.
Okay, great. And was there anything atypical about the test?
Yes. I had high cholesterol, so the doctor prescribed me fish oil.
Okay.
I took it for about a year, and then it went down, and I haven't taken it since then. That was in 2015.
Okay. And you mentioned that it went down since then.
Mhm.
That's great. Good to hear. Have you had an occult blood stool test?
No.
Okay. Typically that's done if we know anything abnormal about
Oh, okay.
abdominal movements or anything like that.
Oh.
So. Okay, I'm gonna go over your family history now.
Okay.
So do you have any children right now?
No.
You mentioned you weren't married.
No.
Okay. And how about siblings?
I have 3 sisters.
3 sisters, okay. And how old are they?
One is 46, one is 43, and one is 40.
Okay, great. And do they have any health conditions that are, I would say, affecting their lives? They're taking medications for, or anything pertinent about their health history?
No, I think they're all pretty healthy.
Okay, great. Good to hear. How about your parents? Are they still living?
Mm-hmm.
And how old are they?
My mom is 71.
Great.
That was pretty